Next, Dr. Jasmine D. Gonzalvo, the Pres and Teresa Timos, Director of the Center for Health Excellence, Quality, and Innovation, and Clinical Professor in the College of Pharmacy. Jasmine provides cardiovascular risk reduction medication management services for the Eskenazi Health for a largely Spanish-speaking population in a federally qualified health center in Indianapolis. She is currently on the board of directors of the Diabetes Leadership Council and is the president of the Indiana Community Health Workers Association. Jasmine?
We all remember 2020 for a lot of different reasons, right? I want to share my 2020 with you, and I'm actually going to start at the end of 2020, and then I'll rewind to the beginning of 2020. December 6th, 2020, I'm sitting in the waiting room, and the mammogram technologist had just handed me a warmed white blanket. I was waiting for the results after she went to talk to the radiologist. You can probably all guess that later that day I was diagnosed with stage 2 breast cancer as a 39-year-old mother of 2 young daughters. And that was in the middle of the pandemic, right? Of course, that time in my life was devastating and an emotional roller coaster, awful, terrible, all of those things. But what I remember most about my time in active treatment was the beauty and humanity that came out to support me during my cancer treatment. It was the relationships that I had created my entire life that supported me that entire time. I got cards, I got inspirational quote books, I got blankets, I got coloring books with expletives in it, I got inspirational songs for a playlist. And one of the things that I remember most is that I didn't cook dinner for 4 months because my coworkers and my colleagues and my friends and my family created a meal train where home-cooked meals showed up in a cooler on my doorstep for 4 months to support me through active treatment. Those relationships are what I attribute to my survival today. As promised, I'll rewind to the beginning of 2020, January 2020, where I was offered the position as the inaugural director of the Center for Health Excellence, Quality, and Innovation. There's a one-pager in your folder that you can read all about it. I was so excited for this opportunity because the first decade of my career, I had really focused on one-on-one patient care, teaching students, diabetes, as you heard in my bio. I looked at this opportunity to become the director of the center as an opportunity to scale my impact, affect populations and communities, policy. That's what I saw the opportunity in January 2020. Think about that time. I became the director of a center right before the world shut down, 2 months later. Now, maybe most directors and newly appointed directors of the center may be a little nervous about that. I looked at it as a huge opportunity for the center that was supposed to improve access for communities. So what we did very early on is we reached out to Gleaners, the largest food bank in the state. And we said, do your communities, do your neighbors, do they need help vaccinate with COVID vaccinations? What Gleaners said was, we don't actually know. We don't collect that data. We're distributing food. But they opened a door to us, a door to a relationship with us. We had an amazing relationship with Walgreens already. So we said, hey, Walgreens, can we do COVID vaccinations in a drive-through model at Gleaners. They said yes, and what happened was we showed up with faculty, students, volunteers. We showed up day after day after day with clipboards and tents outside in the rain, in the sun, in the snow for about a year to vaccinate the Gleaners community. We vaccinated thousands of people. What that then led to was a Gleaners invitation to participate in the Voice of Our Neighbors survey, where they surveyed thousands of people served by Gleaners. And we took the opportunity to ask about medication insecurity. So these people who are experiencing food insecurity, are you also having trouble getting consistent access to your medications? It was a resounding yes. The data told us it was a resounding yes that people were experiencing both food and medication insecurity. So we answered that call. They invited us to implement the first standalone licensed charitable pharmacy on site at Gleaners Food Bank. It was really exciting. You should come see it. And what I really want to emphasize, just as those relationships got me through cancer, the relationships got us through the pandemic. The relationships were the key to our success in that 6-year time period. So as I think back on that time, and for the faculty in the room, you better believe there were publications and presentations and grant funding that supported our work through that time. So we were doing our jobs as faculty and serving the community. Now, as I look out at everybody here, community partners, faculty, staff, I see two opportunities. One's for me and one's for you. The first one is our Purdue students are posting a Dine to Donate fundraiser at Panda Express today, and I would really appreciate it if they have to today. You went to Panda Express, mentioned the charitable pharmacy, and a portion of the proceeds will go to our charitable pharmacy. That's number one. Number two is you're sitting at tables with incredible people to start, build, continue, maintain, develop the relationships that I've talked about today. The relationships that make one day get you through cancer, get you through a pandemic. So these relationships are what I want us to think about to have a greater sense of fulfillment, broader and better impact, and stronger communities. Thank you.